Americans do a great job of planning for vacations, for retirement, for saving money for our kids' education. But it's a rare person I've met who plans for a serious diagnosis.
A health-grade survey finds 1 out of every 6 patients in the U.S. receives care at a less than a stellar hospital. Not getting the best care possible could not only increase your risk of medical errors, it could also increase your risk of death.
Before we get sick, everyone has a notion that there's a healthcare system out there that's suddenly going to spring into action to support them. Unfortunately, that's not the case.
Leslie Michelson is the author of The Patient's Playbook. After his own experience getting treatment for a rare disease, he's made it his mission to help others get the best care possible, no matter how much money they have.
Preventable medical errors are the 3rd leading cause of death in the United States, right after cancer and heart disease.
The first step, he says, is finding a primary care provider who fits your needs.
The most important attributes in a relationship with a primary care physician is that you feel an interpersonal chemistry, that you're comfortable talking to him or her, and they're comfortable talking to you. That person should be your healthcare quarterback.
Next, know your medical background and communicate the information with all your doctors.
Collect and organize all of your medical records, so if that day comes, all of your doctors will know the other things that are going on with you. Record your family medical history. We're increasingly learning the importance of genetics and heredity in disease, and your physicians will benefit from having that information.
And if you need a hospital, don't write off the top ones because you aren't on the Fortune 500.
Most Americans live near major cities. Every major city in the country has a respected academic medical center, and some have many of them. Generally, those hospitals are in-network for Medicare and all the major carriers, and their staff physicians are in-network as well.
Finally, make sure you assign a family member or friend who can protect your interests.
And last, think through who in your life, loved ones, friends, you want to be your health advocates, because it's not safe to go into a hospital without somebody representing you. It's not safe to navigate through a tough diagnosis without having a loved one or a friend be your advocate.
Michelson says that the more control you take over your health, the less you'll worry about any issue related to your care. In New York, I'm Dr. Manny, Fox News.